So, you're looking for a therapist. It can feel like you're trying to navigate a maze without a map, right? Especially here in Nassau County. Well, think of this explainer as your guide. We're going to give you the clear, practical info you need to turn what can be a really confusing search into an empowered, confident journey.
Yeah, does this question hit home? If it does, you are in exactly the right place. Just taking that first step is huge. But then all the jargon and the options, it can feel like a lot. We're going to cut right through all that noise and give you a really clear place to start. Okay, so first things first. Before you can find the right therapist, we need to be on the same page about what a professional therapist actually is and what they do. Getting this part clear is, honestly, the most important first step in making a choice you feel good about. Now, there are a couple of words on this slide that are absolutely crucial: licensed and evidence-based. This is the stuff that separates professional therapy from just, talking to a friend. A therapist is a highly trained pro who uses strategies that are backed by science to help you navigate whatever you're going through. So now that we have a solid definition of what we're looking for, how do you actually find one? This next part is all about action. We're talking practical steps you can take to find a professional who is the best possible match for you. Here's the key. Don't try to do everything at once. Just break your search down into these 3 simple steps. First, make sure they're licensed. It's a non-negotiable. Second, figure out their specialty. Does it line up with what you need? And third, think about the logistics. What actually works for your life? In person, virtual, let's figure it out. When you start looking at licenses, you're going to run into this alphabet soup of credentials. These 3 you see here are the most common ones you'll find in New York. Seeing LCSW, LMHC, or PsyD after someone's name is basically your guarantee that they've met the state's really tough professional standards. They just come from slightly different training backgrounds, that's all. And this leads us right to the super important topic of specialization. Therapy is not a one-size-fits-all kind of thing. It really helps to think about what you're hoping to work on. Are you struggling with anxiety, going through a big life change? Finding a therapist whose expertise lines up with your goals is one of the biggest factors for success. All right, so we've talked about checking for a license, but let's go a little deeper. Understanding what's actually behind those credentials is so important. This section is all about decoding what those letters really mean so you can build real trust in the process and the professionals you're looking at. Now, here's something you need to know. Unlike, say, an unregulated life coach, a licensed therapist is held accountable by an official state group, the NYESD. They have to meet incredibly high standards, and that whole system exists for one reason: to protect you and make sure you're getting quality, ethical care. 3,000! Just let that number sink in for a second. That is the minimum number of supervised hours of experience someone has to complete after they already have a master's degree, just to get licensed here in New York. It's a huge amount of training. And yeah, those 3,000 hours aren't just busy work. As you can see, it all starts with an advanced degree. Then, at least half of that time, 1,500 hours, has to be direct, face-to-face work with clients. And it doesn't even stop there. They have to keep learning every single year to keep their skills sharp and their license active. Okay, so you've done the research, you found someone promising, and you've booked that first appointment. That's fantastic. Now, let's pull back the curtain and talk about what that first session is actually going to be like, because having the right expectations is key. This is so important to understand. The main goal of this first meeting is really about assessment and, data collection. It's the therapist's job to get to know you, but it's also your chance to interview them. You don't have to spill your deepest secrets right away. Just think of it as a consultation to see if you click. This whole intake thing usually follows a really clear, logical path. It kicks off with your first call or email. Then there's usually a quick screening call to make sure it's a good fit. After that, you'll handle some paperwork. That leads to the assessment we just talked about, and it all ends with you two working on a treatment plan together. Every step is there for a reason. I love this table because it's a great way to see the difference between really high-quality care and, the bare minimum. Look at the stuff under proper hybrid care. They offer in-person and virtual sessions. They'll coordinate with your other doctors. Their licenses are verified. That's a whole different level than just some isolated, unverified online therapy. All right, let's wrap this up by tackling some of the most common, real-world questions that people have. We're going to go through these rapid-fire style to give you some clear, straight-up answers. This is a big one. Probably one of the most important questions people have, and for a really good reason. You have to know you can speak freely. And let me be perfectly clear, the answer is a huge yes. Your privacy is protected by federal law, HIPAA, and our own state laws. A therapist cannot share what you talk about without your written permission. The only exceptions are in very rare situations where there's an immediate threat to safety. Another great question we hear all the time. Can the person you're talking to actually prescribe medication if it turns out you need it? So this slide lays it out perfectly. Your therapist is your go-to for talk therapy. A psychiatrist, who is a medical doctor, is the professional who actually manages and prescribes medication. It's actually really common for them to work together as a team to give you the best possible care. And of course, the big practical question on everyone's mind, what about the cost? Is this something your insurance is going to help you with? Well, the good news is that thanks to a law about mental health parity, most big insurance plans have to cover mental health just like they cover physical health. But, and this is a big but, every plan is different. The single best thing you can do is call your insurance company or the therapist's office directly to confirm exactly what your plan covers. I love this quote because it totally reframes the whole search. See, it's not about you just being a passive customer shopping for a service. It's about you being an active partner in finding the right professional relationship to help you on your journey. So we'll end on this. After everything we've talked about, from licenses and specializations to what to expect in that first session, the power is really in your hands now. So what's it going to be? What's the very first concrete question you're going to ask to take that